Diabetes is one of the largest global health emergencies, and year over year, more people worldwide are diagnosed with this serious chronic condition. Chelsea Kwong, patient care pharmacist at London Drugs, is here with more about it and how to manage it. Good morning.
Hi, good morning, Corey.
So Chelsea, how common is diabetes and how can someone find out if they have it?
So in Canada, it's estimated that about 30% of the population has either diabetes or prediabetes. Some of the risk factors for the development of diabetes include your age. So the older that you get, the more likely it is that you have diabetes, your gender, so adult men are at higher risk than adult women, and your ethnicity. So some ethnic groups are just at higher risk than others. But some of the things that you can do to help prevent the development of diabetes include your level of physical activity and your weight. So if you do have some of these risk factors, or if you have a family history of diabetes, it's important to talk to your healthcare provider about being screened.
Okay, so you want to get screened for it. As you said, you mentioned a few, but what other lifestyle and dietary changes can be made for someone at risk of diabetes?
So for someone with either prediabetes or type 2 diabetes, and if they are overweight or have obesity, weight loss is actually the most important and effective strategy for normalizing blood sugar levels. A registered dietitian is a really great resource for learning which types of foods to eat. But in general, a diabetes-friendly diet includes less processed foods, such as sugar-sweetened beverages and fast foods, and more of those low glycemic index foods. So things like beans, whole grains, lean proteins, fruits, and vegetables. A weight loss of even 5 to 10% can make a big difference towards normalizing blood sugar levels.
Okay.
For physical activity, working up to getting a goal of about 150 minutes of moderate to vigorous activity a week is a really good goal.
Okay, and you mentioned a few times blood sugar levels. How can someone check them?
So if your doctor or nurse has recommended that you check your blood sugar, there are many different devices available at the pharmacy. The most common devices use a very small amount of blood from a finger poke, which is placed onto a test strip and then inserted into the blood glucose machine. These devices are very, very accurate and come with many different features to suit the different needs of different patients. If someone needs to check their blood sugar more often, then a continuous or flash glucose monitor might be a good option for them. So these devices include a very small sensor, which is placed onto the skin, and then either a reader or a smartphone app will be used to display the blood glucose reading. Your pharmacy team is a really good resource to help you choose what type of machine would be right for you.
Okay, and do you have any other tips for people living with diabetes?
Well, living with diabetes obviously can be difficult, but your pharmacist and other healthcare team members are there to help. Your pharmacist can review your medications to make sure that you're getting the most benefit out of them, can help you with blood glucose testing or learning how to use insulin, and can offer suggestions to help simplify your medication regimen. They can also help keep you healthy in other ways, like setting those physical activity goals or ensuring that you're up to date with all your routine vaccinations.
Perfect. Chelsea, I want to thank you so much for this information this morning.
Yeah, thank you, Corey.
For more pharmacy information, visit londondrugs.com. As a reminder, please talk to your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition.